Can you imagine a world without TPA? This protein, which is taught so widely as the hallmark treatment for acute ischemic stroke. Well, today we're going to be talking about the ECASS trial, which is one of the two major landmark trials that ultimately established the safety and efficacy for TPA in treating stroke. The other trials, the NINDS funded trial, we'll be talking about this one next week. These trials were published within weeks of each other in 1995, and the ECASS trial was a randomized, prospective, double-blind, controlled trial across 75 hospitals throughout 14 different European countries that ultimately randomized patients within 6 hours of acute onset stroke symptoms to either receiving TPA or placebo. The primary endpoints were the Barthel Index and the modified ranking scale at 90 days. In the target population group, there was no difference in Barthel Index, but the TPA group had significantly better modified ranking scale. Median hospital stay was shorter in the TPA group versus the placebo in the target population. There were no significant differences in the 30-day mortality between TPA or placebo groups. However, in the target population analysis, the TPA group did have a higher 90-day mortality rate. Furthermore, the TPA group had a significantly larger number of parenchymal hematomas. Ultimately, the authors conclude that TPA is effective at reducing some functional deficits, but that treating some patients with TPA can lead to complications. Next week, we have the NINDS trial.